Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. You can listen on air or online at iHeartRadio, Odyssey, TuneIn app, smart speakers, any podcast venue of your choice, or our own WHPC app, which brings you award-winning content, and you can download it to your podcast venues. Herbally Yours consistently brings you the latest information about the many facets in the world of natural living. And today we are so happy to have as our guest Dr. Michael Platt, who is a board-certified physician in internal medicine and still has a practice in Palm Desert, California, devoted to wellness and a preventive approach to illness. He is recognized nationally and internationally for his approach to natural hormone replacement. And you can find him at plattwellness.com along with his work. Today, we're really going to delve into a book that he wrote called Adrenaline Dominance, a revolutionary approach to wellness. So thank you so much for joining us today, Dr. Platt.
I'm glad to be here.
Now, you wrote this book called Adrenaline Dominance, a revolutionary approach to wellness, where you talk about its adrenaline's link to so many issues such as ADHD and fibromyalgia, and also to anger, depression, and severe PMS, so many different things. So let's go into what adrenaline is and why we need to know about it.
Most people have heard of adrenaline, and they know it as what they call the fight or flight hormone. So when people are in danger, the body pours out adrenaline. But that's actually a very rare reason why the body puts out adrenaline. You know, adrenaline is a hormone as well as a neurotransmitter, but it's a very powerful hormone and a powerful neurotransmitter. You can see where the release of this element can cause problems, but nobody ever talks about it and nobody ever writes about it, which is surprising to me.
Well, is it something that physicians measure to see what your baseline adrenaline level is and when you might get a spike, what it goes up to? I've never heard of that. So have you?
Well, you can measure adrenaline. It's not the best test for finding out if you have excess adrenaline, but excess adrenaline is never tested for, ever.
I've never seen it. That's why I'm saying that. That's right.
And the thing about adrenaline dominance, when people are putting out adrenaline to the point that it affects what's called the quality of their life, that's adrenaline dominance. And the tragedy of this whole thing is very easy to treat. Unfortunately, people deal with problems related to excess adrenaline, starting from a very young age. Babies that have colic, that's adrenaline. And you can actually
that's a great example, because any parent who's seen, or even grandparent like myself, who's seen an infant have a colic attack, they're not happy, right?
No, they're not.
And there's a lot of tension.
But we're going to be talking about progesterone cream, because the progesterone cream in the right strength blocks adrenaline. And if you take some progesterone cream and rub it on the baby's belly, the colic goes away in about 5 minutes. So you don't have to stay up all night with a crying infant. Now, just, for those pregnant women who may be listening, women that have a fetus that is doing a lot of kicking, that's usually, again, related to excess adrenaline. And that's the baby that will probably wind up having colic. And then as the child gets older, there's they have a problem with bedwetting, and bedwetting is only caused by excess adrenaline. And then a couple of years later, when they're in school, ADHD is also caused by excess adrenaline. And so instead of using one of those drugs like Ritalin or Strattera or Adderall, which actually increase the amount of adrenaline that the person has. And that's why sudden death is one of the side effects of these drugs. But you can actually get rid of ADHD in 24 hours, just again, by lowering adrenaline levels.
So you're saying that most children, and boy, oh boy, I would say that you probably know as a physician that the rate of children in any given classroom today of that are said to have ADHD, it's astounding. And we're being told it's genetic. Why wasn't it genetic when we were kids? It can't possibly be genetic.
But actually, excess adrenaline is genetic.
In terms of the production of it. Okay.
Yeah, if a child has ADHD, that means that one or both parents have ADHD. But, in my book, Adrenaline Dominance, I talk about the good, the bad, and the ugly. And the only condition that I put in the good section is actually ADHD. And the reason I do that is because the most intelligent, successful, creative people in the world have ADHD. And so how bad can it be? And, and people have to understand that ADHD it's not a learning disorder. It's an interest disorder, which is why I question why they have algebra in high school. It's a subject that once somebody leaves high school, they'll never need algebra. So, and it's a kind of subject that a lot of people are not interested in. So they'll struggle with that. So they maybe should be looking for subjects that exacerbate ADHD. But that's just my feeling. But we're going to talk about treatment.
So you're saying that somebody, in terms of adrenaline, what is considered a normal amount? What is considered, is there too much? Is there too little? And what influences an individual as having an amount, like normal amount, too high amount? As you said, it's linked in everyday life. People might recognize it as a spike in adrenaline when you're under pressure, such as the flight or fight hormone.
Somebody does have excess adrenaline. First of all, they'll have trouble sleeping. Adrenaline actually peaks at 2:30 in the morning. And a lot of people get up at that time to urinate because adrenaline gives people that urge to urinate. They have a thing that they advertise on television called an overactive bladder. And an overactive bladder is definitely just due to excess adrenaline. And so instead of taking medication for it, you can actually just lower the adrenaline levels.
Okay, wait. When you said just lower the adrenaline level, if people have many of these symptoms and syndromes, which may be linked to excess adrenaline, what are some of the things you recommend to lower it?
One of the faults with our whole medical system is that doctors are not well trained in treating the cause of illness. They give out Band-Aids, which is why nobody ever gets better. So even when it comes to adrenaline, you have to treat the reason why the body is releasing it.
Excellent, right.
Now, let's put danger aside, because that's a small factor. What most people do not realize or understand is that the brain uses more sugar than any other tissue in the body. And anytime the body detects that there's a drop in adrenaline in the brain, the body automatically puts out adrenaline to raise sugar levels. It's a process called gluconeogenesis, where the body converts protein into sugar, but it's mediated through adrenaline. So the point is that if you provide the brain with the fuel that it requires, then the body doesn't have to use adrenaline to get the fuel. So the brain uses two different fuels. One is glucose. That's the type of sugar that it uses. And the best source of glucose for the brain actually comes from vegetables. And the reason for that, the sugar from vegetables don't produce a lot of insulin. So you don't get that lowering of the sugar level. Now, the other fuel that the brain requires is even more important, and that's ketones. And the best source of ketones, instead of going on a ketogenic diet, which is difficult, You can get ketones directly from coconut oil, which is a great fuel for cooking, or MCT oil, which has no flavor and you could add it to anything. A lot of people put it in coffee. They call it bulletproof coffee. So, so by providing the brain with the fuel that it requires, you get an immediate drop in adrenaline. People that have like road rage, which is only caused by excess adrenaline, will get rid of it in 24 hours.
So wait a minute. Those are all a lot of interesting information there. So let our listeners know that
Okay.
You are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. You can listen live, on air, or online at nccradio.org, iHeartRadio, or any podcast venue of your choice. And today, our guest is Dr. Michael Platt, and he is board-certified physician in internal medicine and has a private practice in Palm Desert, California, a lovely place, devoted to wellness and a preventive approach to illness. And he is known nationally and internationally for his innovative approach to natural hormone replacement. You can find out more at www.plattwellness.com. So you have a lot of interesting information there. So you're talking about adrenaline. You also threw out progesterone cream as something that might be useful. And now you're telling us that using certain oils such as MCT, which means medium chain triglyceride oil, or a good quality coconut oil, is a good thing. And you're saying that helps, and that people have different amounts of adrenaline release that might be linked to things like fear. That's something we've all heard of, the flight or fight. But you're saying some people just generally, because of genetic factors, perhaps nutritional factors, what other kind of factors, have too much of an adrenaline release, which can cause all kinds of things, like you mentioned, waking up at 2 in the morning and having to go to the bathroom, and lots of other things. What about things like anxiety that people sometimes have when they're facing something?
The only thing that causes anxiety is actually excess adrenaline.
That feeling. That's really interesting.
And stress. People talk about stress. Well, again, that's adrenaline. A lot of people blame cortisol, but cortisol responds to stress. But what causes stress is the adrenaline. But also, when people have a lot of adrenaline, they might find they're quick to anger, a little bit short fused, and they might notice that they have cold hands and cold feet because adrenaline constricts blood vessels. They'll carry tension in the back of the neck, and this tension can cause tinnitus, which can be eliminated just by putting some progestin cream on the back of the neck, or people can get a headache called occipital neuritis. Now, occipital neuritis causes excruciating headaches, and 100% of the time, it is mistaken for a migraine. But these are not migraine headaches. These are easy headaches to get rid of just by putting progestin cream on the back of the neck.
So it's worth trying. And also, you are so interested in adrenaline and our lack of knowledge about adrenaline that Dr. Platt wrote a marvelous book, which we're looking at today, called Adrenaline Dominance, a Revolutionary Approach to Wellness. Because look at how many things you're talking about. If somebody's getting this kind of headache and it's actually linked to adrenaline, that they may be able to get help more easily than they thought.
And they can actually help themselves because you don't need a prescription for a 5% progestin cream. And anybody can do the meal plan.
Wait a minute. Wait. That's a little trick question there. What do you mean, the meal plan? What is the meal plan?
The meal plan would be eating the vegetables and using coconut oil and MCT oil.
Okay.
If people need it, I have a meal plan on my website that they can access.
So they could actually go to plattwellness.com and then you have a place that they can find this meal plan, which is helpful. If it's helpful for adrenaline, then it's good for stress in general.
Exactly. And also they can get a 5% progesterone cream means that each pump is 50 milligrams. And that's the exact strength you need to block adrenaline. And people have to be very careful. Oral progesterone is not progesterone. It converts into a different hormone. And yet that's the progesterone that's most frequently prescribed is an oral progesterone. But when it goes to the liver converts it into allopregnanolone, which is not progesterone. So I do not recommend the oral progesterone.
But the progesterone cream is delivered transdermally, right? Like you put it on the skin.
Right. It goes right into the bloodstream.
And why is that different in terms of the metabolism?
Well, because they're bypassing the liver. So when it goes to the progesterone receptor sites, it's progesterone. Allopregnanolone does not go to the progesterone receptor sites.
So you're saying it's much better to use it as a cream, which has to be something that will go through the skin. So it has the right application to get into the bloodstream through the skin. So that's good.
Your listeners might be interested in knowing that, a lot of people are concerned about weight. And what's interesting is, keep in mind that the reason why the body is putting out adrenaline is to raise sugar levels for the brain. And the thing about sugar, it doesn't matter whether you're eating sugar or if the body's making sugar. If you don't burn it up, then the body will take that sugar and convert it into fat in the fat cells. Now, keep in mind that adrenaline is peaking at 2:30 in the morning when people are lying in bed. And when the body releases adrenaline, it's a powerful hormone and creates stress to the body. So then the body puts out cortisol to deal with the stress. And the first thing cortisol does, it also raises sugar levels. So while people are lying in bed, not moving, they're putting out two hormones that raise sugar. And I'm pretty well convinced that this is like the number one cause of weight gain, and nobody ever talks about it. And the other thing is, if people do want to be tested, the test that I would recommend is a morning cortisol before 9 o'clock, a cortisol level, a blood level, not a saliva level. I do not.
Okay, that's different.
I do not recommend saliva tests because the thing about adrenaline, which is a survival hormone, it cuts off blood supply to areas of the body not needed for survival, and that includes the salivary glands. So when people have that salivary test, they wind up with a low cortisol, and based on that low cortisol, doctors will diagnose adrenal fatigue, which is a condition that doesn't exist. Adrenal fatigue is really adrenaline dominance. But then, I talk about all of this in the book. There are conditions like PMDD, which is premenstrual dysphoric disorder, hyperemesis gravidarum, cyclical vomiting syndrome. All these conditions are felt to be incurable, and they're all caused by excess adrenaline.
And that person's sensitivity to it. So I imagine that varies from one individual to another, but it's certainly something that is rarely addressed or maybe never addressed, and that's why information in your book might really open people's eyes to a way they can be helped. So it's called Adrenaline Dominance, a Revolutionary Approach to Wellness. Is that what made you want to write the book, because the information is not widely available? It's not available at all, actually. They have books to talk about stress and cortisol, but none that I'm aware of that talk about adrenaline, and which is unfortunate because, providing the right fuel to the brain and using progesterone cream, you get immediate results. Is there any downside to using progesterone cream? I mean, what about men? What about children? Because if not, it might certainly be a wonderful thing to try.
Well, doctors are very reluctant to provide hormones to children, but progesterone is an extremely safe hormone. Well, when the fetus is in the womb, it gets exposed to incredibly high levels of progesterone. I mean, levels that cannot be duplicated. So if the fetus can tolerate that much progesterone, you would think a child should be able to tolerate. And I've never had any feedback from any parents who I've recommended progesterone to where the child had any problem with the progesterone. Even autism, children with autism have incredibly high levels of adrenaline. And so all this is very beneficial for children with autism. Kids that have autism that aren't speaking will all of a sudden start speaking. It all comes down to it's very rewarding, to get somebody well again. And
that's probably why you wanted to be a doctor in the first place when you were a little kid.
Probably.
And yet, like you said, so many doctors originally may have that thought in mind. Boy, I'd really like to help people. That's why I'm going to become a doctor. But then they get very frustrated unless they've gone into integrative medicine like you have, where you really see results. And they're very unhappy because they're just giving people one drug after another and all kinds of dangerous invasive tests. And what you're doing, you actually see a change for the positive using something that has a very low incident or none of an adverse effect. So that's what you meant to do in the first place.
Exactly. I had a patient that came in to see me who was about 47 years old. And the reason he came to see me is that every morning he would wake up and vomit. And, the only thing that can possibly cause that kind of reaction is excess adrenaline. And so, and he also had very severe fibromyalgia, which again is another condition caused by excess adrenaline. So I put some progesterone cream on his arm, and he rubbed his two arms together, and we started talking again. And about 5 minutes later, he sat back in his chair and he looked at me and he said, "Doc, in my entire life, I have never felt this good." And since he left my office, he's never had another episode of nausea and vomiting. And needless to say, his fibromyalgia disappeared.
So isn't that great? So the only change was that now does he use that progesterone cream ongoingly? Do you determine how many times he applies it, et cetera?
Everybody's different. There's no one size fits all.
Okay.
And most doctors and most people think that progesterone is a woman's hormone.
That's right.
And it is, but they're not aware that men also produce progesterone. But men stop making progesterone around the age of 50. And it's after the age of 50 that men start getting prostate cancer and they start developing, fat around the waist. And the reason for that, they no longer have progesterone to block estrogen, which causes prostate cancer, or insulin, which puts on weight around the middle. So progesterone is an extremely important hormone for men also, not just women. But, I mentioned that nausea and vomiting that patient had. Hyperemesis gravidarum, this is women that vomit throughout their entire pregnancy. And cyclical vomiting syndrome is where children wind up having to be hospitalized because they can't stop vomiting. And again, this is all caused by adrenaline, and nobody talks about that. And it's very surprising to me that it's gone this long with adrenaline being ignored. Right now, insurance company, the pharmaceutical industry, they're interested in drugs they can patent. Now, progesterone is a natural product. They can't patent it. So that could explain why nobody's doing anything about this. I don't know.
Well, I've heard of using progesterone cream, and we've used it in our clinic. I was the head nurse at an integrative center with Dr. Serafina Corsello, and I was her head nurse for 23 years. So we used it a lot, but I never heard it discussed in terms of its link to adrenaline the way you're describing today.
Well,
and also the fact that you're pointing out that I don't know if there's no downside, but I think you're sharing that there's either none or very little downside for someone to try it.
The only downside is when people have a condition called type 3 diabetes. Now, type 3 diabetes, everybody's heard of type 1 and type 2. Type 3 is insulin resistance in the brain. What that means is that the insulin in the brain has a hard time getting glucose into the brain cells. And what's important about type 3 diabetes, it's one of the precursors to Alzheimer's. But the whole thing about Alzheimer's is it's really preventable. And so if somebody uses progesterone cream and they get an immediate reaction of the body pouring out adrenaline, which is the adverse reaction, these are people that have type 3 diabetes. And these are the people that should start using MCT oil and coconut oil and eating vegetables, just to give the brain fuel. And that will help prevent Alzheimer's from coming on.
So that sounds like a good thing for people to try, is use coconut oil and other forms of MCT.
Yeah. But the... but adrenaline is not all bad. It's important for people that are professional athletes because they need adrenaline, and people in law enforcement have a lot of adrenaline, which
because you're constantly under that kind of fight, flight, or fight scenario. So
exactly.
And then you'll use it up if you don't have it. So that's true. So everything in balance, but it's really interesting that people can find out more because of the ripple effect of addressing adrenaline dominance on so many different issues in healthcare. So I want to thank you so much for being our guest today. Thank you for writing your book, Adrenaline Dominance, A Revolutionary Approach to Wellness, and people can find out more at plattwellness.com.
Yeah, the book is also available on Amazon if it's easier for them.
And thank you, Doctor, and thank you, listeners, for tuning in to Herbally Yours, once again produced at the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email whpc@ncc.edu. or me directly, your host, Ellen Kamai, at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.